There is a new push from the American Heart Association to raise more awareness about sleep apnea, especially for people with heart problems. Officials say if this condition is left untreated, it would continue to interrupt your breathing during sleep and ultimately lead to cardiovascular disease and more complications like high blood pressure, heart rhythm disorders, stroke, and more.
You don't have to go to a sleep center to get diagnosed. You can actually get a home sleep study done. In addition to CPAP, which is still very helpful for some of the patients, we have alternative therapies. So if patients don't want to wear a CPAP machine or they're intolerant of it, we can actually treat them appropriately with oral appliances.
Now, risk factors for sleep apnea can include obesity, smoking, and family history.
It is estimated that more than 60,000 people in our state have epilepsy. Hartford Healthcare's Neuroscience Institute is one of the only places in our state with advanced technology designed to improve treatment of seizures. Channel 3's Kara Sunland spoke to Dr. Gabriel Martz to find out more about those treatments in today's medical rounds.
Thank you so much for being with us.
And my pleasure, Kara.
So, why do people have seizures?
The brain works with electrical networks. That's how each part of the brain talks to each other to make you do anything, whether that's talking, whatever the behavior is. Seizures hijack that network, and they basically cause short circuits in the electrical activity of the brain, and that's what causes the body to act funny sometimes, or the mind.
So do seizures actually cause brain damage?
Well, they can. So as a seizure uses a lot of energy from the brain cells that are part of that electrical circuit. Anything that can cause a seizure, any disturbance of the brain can cause a seizure. So it could be low calcium in the blood can cause a derangement of the cells that allows a seizure. Epilepsy, of course, is a chronic state where seizures keep happening. So in terms of damage, if the brain cells are starved of oxygen because they're already injured from a bleed in the brain or low calcium, whatever else it is, a seizure can cause damage, particularly if it's a very long seizure. So we know that seizures that normally stop after about a minute, but some seizures don't, and they go on half an hour, they can go for days long, and that definitely can cause damage.
Talk to us about the long-term monitoring you offer with EEG, and how does that help?
Yeah, pardon me. Yeah, so we're very excited about that because long-term monitoring basically means continuously watching the brain's activity through EEG wires that are attached to the head. We also have continuous video monitoring so we can see what behaviors a person might be having during a seizure. The reason this is so helpful is there's lots of times when somebody could be having seizures. We don't know. Let's say someone has had a bleeding in the brain and they're in a coma. We don't know if they're having seizures because a lot of times seizures don't manifest as jerking or movements of the body. They're just something you can see in the brain when you're watching specifically the brain waves. So by taking people like that who are at risk for seizure and monitoring them, we can see if on top of the brain injury they've had, they're also having seizures, which of course would change the treatment. And another really important aspect is avoiding treatments that they don't need. So someone who, for example, has septic shock from an infection, they might be in a coma, they might be shaking at the bedside, maybe they're shivering because they're fever. Well, that's not a seizure. So by having LTM monitoring and showing that it isn't a seizure, we're actually avoiding worsening them by adding sedating medicines they don't need.
And thank you, doctor, for letting us know. I know you're one of the few, along with Yale, CCMC, and St. Vincent's, that have this long-term monitoring. So want to let people know about that. Dr. Gabriel Martz, thank you for being with us. And want to let people know that they can get more information at hartfordhealthcare.org/epilepsy.